from around the state, and these sessions have been really helpful to share information and network with SNAC members from around the state, and we really wanted to understand the professional capacity and viewpoint of various topics to really understand how we can help the network and serve you all in the next year. So currently right now, me and Julian and I are planning to review all of the story maps that we made from the dialogue sessions, from the Jam boards, and all the information that was collected, people's comments, and any resources that were shared, and compile that into a final report. And then we are hoping to review that and provide recommendations for engagement next year. And this will be sent out to all who attended the sessions once we have compiled that information. So again, thank you all so much to all the presenters and everyone who attended and participated. It was really great. We really hope you guys got a lot out of it. We do still have 2 more. We have the November session and the December session. Both you can register for on the SNAC website. So if you're interested in that, feel free to do that. But we are looking forward to finishing out the year with these, and depending on what happens with that final report, we may do something similar in the future. So we will keep you updated as we go. And again, this has just been a review of the sessions that we've had through the past year and the topics. For November, we have the mayor of Crawfordsville, who will be speaking and doing the grounding presentation. And then December, we have Michelle Shippey, who will be doing a presentation on some of the nutrition incentive programming in Indiana.
Great, thanks, Amy. And I just sent the link to the SNAC website and the events that are upcoming, and both the dialogue sessions are on there if you all want to register or just learn more. Another thing we've been working on that we have discussed in the past is our PAN Partner Engagement Learning Lab. So Amy and I and Ashley Sudbury and Jonathan Barclay sat in on the National Association of Chronic Disease Directors group to put together a collaborative for Indiana. So we've been working to envision what a collaborative across state agencies and FNS programs would look like to really organize this information and deliver programs, information, application processes in a very efficient way. So it's taking longer than we had originally thought. We're still looking through plans and wordsmithing a lot of things to make sure things make sense to send up to our leadership. So not a ton to update here compared to what we talked about last time. So if you all have any questions on this collaborative and working across systems and spaces and want to know more, get involved, please let us know, but we will hopefully have more update on this in the new year. All right, we can move along.
Right, and just a reminder, the SNAC website is up and running, and we really want you guys to use this as a tool to glean any and all information. If there's anything that you would like to share with SNAC or you would like to promote that your organization is doing, feel free to send that to the SNAC email or email either Julia or I, and we will make sure it gets added. So check that regularly. We're always adding new resources and new information. So yes, please check that out, share it, and also you can also follow us on our social media, which you can also find through the website.
Great, listening sessions. So as I mentioned, we are going to be doing a little bit of shifting with our listening sessions. We're actually going to be renaming them to the SNAC Community Conversations. We thought it had a better ring to it. So as we move into next year and implementing those, that's the title that you can be looking for. But as a little bit of background, we are partnering with the Indiana Minority Health Coalition and a group in Fayette County to implement these listening sessions. We are currently meeting with the affiliates and getting feedback on the questions that we've developed along with them, and we're working through a lot of logistics. And as I said, it took a little bit longer than we had anticipated. We wanted to do it in the fall so that all of the information could come together by the end of the year, but it didn't work out that way, which is totally fine. We're just restructuring some things and working on that in the next year. We are going to be in Vigo, Delaware, Lake, Fayette, and Tippecanoe counties. And am I back? Okay, I think I froze for a minute. And the goal is really just to create a space to converse about food, about experiences within SNAP Ed programming, trying to understand where people are and just open up that space for a conversation. So, as I mentioned before, we've really tried to co-create this experience with the affiliates and with community members. And so that's why it's taking a little bit longer, is it just takes time to go back and forth on communication. And we are hoping to implement these by May of next year. So we will provide more of an update as that goes along. Debbie, do you have a question?
Yes, I do. We are just starting to get involved with the connections in health and having listening sessions and stuff. And I see that Lake, they've done that too. Um, have you found, or I don't know if, have you started any of the listening sessions? And my concern is, and my question is there a problem getting people to do multiple listening sessions? I mean, if they do it for one part of what we're doing, and then we're asking them to do it again, and you haven't named my county, so um, but I'm anticipating. So I don't know how many people in my community would be willing to do a second time. So, and or a third time, depending on what other organizations in my county are doing stuff. So, and having listening sessions. So, how is that working, or will that work?
Yeah, thanks for that question, Debbie. We are familiar with what Connections Health have been doing, and we're taking a little bit of a different approach here. We're with SNAP Ed funding, we work in SNAP eligible populations. So we are specifically working with that demographic and have looked at the Connections in Health process and are trying not to overlap. We don't want that. We really just want this to be a conversation, and it's very much going to be a piloting type of program. So we would love to continue to implement this, but we definitely hear you and have discussed amongst ourselves the idea of just burnout among communities and not using the information and then just not coming back or leaving. We really want this to just open up a two-way conversation between communities and us here at the state and other local affiliates and leaders. And we just want to move in that direction of community members being included in the process. So would anyone from my team like to add anything else about the listening sessions and their focus?
Okay, thank you. I appreciate it. Because our county is actually, the two counties I'm working in are all completely SNAP eligible. So it includes the entire county, and that again, that's where. But I appreciate you looking into that and keeping that in mind. Thank you.
Yeah, absolutely. And it would definitely be something that we consult with communities first. We wouldn't just come in and assume that that's what's needed. So thank you for bringing that up. It's a very important point, especially not wanting to use any information or use communities for any reason. All right. Any other questions about the listening sessions? Or community conversations? I'm gonna have to rewire my brain on how to say it. All right, we'll move along. Veronica, go ahead.
Hello, good afternoon. I think because I'm in Lake County and we've had connections in health in our county, and I think the differences between the two with the SNAC community conversations with through IMHC and connections in health. IMHC's SNAC community conversations, it's going to be targeted the actual community members versus connections in health has worked more with community organizations. So I think am I correct? I think that's the difference that we're going to be moving towards with the SNAC community conversations through IMHC is actually talking to community members.
Yes, that's correct. Thank you
Okay.
for that clarification. Yes, it's going to be more of a town hall, if you will, a forum. Like I said, we're working to understand what format would work best for the IMHC affiliates there. But we've talked about, gathering around a meal or something where people can come together and just have a conversation and take a little bit less of a we would welcome, community organizations to come, but we would really love to hear from community members. Thanks for that, Veronica. I appreciate that. All right, we can move along then. And if you all have any more questions or concerns around that or things we should consider, please just let us know.
All right. And wanted to give you guys next an update on how the student networking event went. We had that towards the end of September, and we thought it was a pretty good success. Although there was a small number of attendees, only 3 students were able to make it. It was a very, very fruitful conversation. And the recording was sent out to partners at universities, and it has gotten several more views. So we're really hoping the students out there were able to benefit from that. We want to give a huge thank you to our university partners for spreading the word, as well as a huge thank you to our speakers, Annie Eakin, Calvin Roberson, Marcia Sweet, and Robin Mallory. I think that they also enjoy themselves quite a bit. That in addition to being able to answer questions for students about their careers, it was actually a really great time for them the 4 of them, to just connect and network with each other. So it was a really great event all the way around. And we do plan on having another student networking event in the spring, on February 22nd from 4 to 5:30 via Teams. So yes, we will have more speakers then. And if you are interested in speaking at a future student networking event, please let us know. We would be happy to have you. All right, Julia, what are our plans? What's coming up?
Plans, yes, we are figuring that out as we speak. So as Amy mentioned, we're really going to be going through our dialogue session information and just seeing what people are interested in, concerned about, would want to learn more about, and we're going to really use that information to guide us for 2023. I can't even believe it's going to be 2023. So we're going to be exploring whether it would be helpful to have different networking opportunities, webinars, continuing education, anything like that that would be helpful. But we really need to hear from you so that we know. So on the screen, you will see a QR code. If you would like to use your phone to fill out an interest survey for us, that would be really helpful. I'm going to also put it in the chat. And I know it's so hard sometimes to peel away and to do a survey. So we thought we would just take a few minutes here to start this and go through it. All the information is going to be used for is just to guide us in the next year as we're still figuring out our structure with our steering committee and with SNAC in general. We really just still want to engage you all, and we just want to know how best to do that. So if you wouldn't mind just starting this over the next couple of minutes, and then we will move on to organizational updates.
A quick question on question 12. It has, that's the one that please indicate your level of agreement with the following statements. And it's, I'm guessing it's supposed to be like strongly agree to strongly disagree, but the listings is option 1 through 5. Would you have a preferred, like, where would you like strongly disagree to start?
Thank you for catching that, Elise. Strongly disagree will be 1 and strongly agree will be 5, please.
Okay, thank you.
Thank you. All right. We will go ahead and move on here. Thank you so much for taking the time to do that. We'll send it out with the minutes and we'll do reminders as well, but we thought it would be helpful just to at least start that interest and conversation there. All right, we're going to move into organizational updates. So we will start with Legita or anyone from Legita's team that would like to give a WIC update.
I am Yvette Robinson. I'm Legita's team. Right now, we're in the process of trying to finish up our state plan, and have been in the process of trying to work electronic process for our FM&P program here. So hopefully, if things work out, it will barcode module like we just for the QR scan code scan, just like what we just scanned. That will make it easier for us to keep everything updated from the local agency our end, and also be able to assist the clients when they're having to keep up with paper check vouchers, and things like that. So once the details have been worked on our end, we will have everyone notified as to the changes. But as of right now, the part that's really keeping us busy is the state plan. So we're almost done with that. And then I am going to be, my position is a commodities program specialist, which basically entails me as a field auditor. So I will be monitoring the local farmers markets, the food pantries, and those vendors that do the CFAP and things like that. So that will be what my position is. I've only been in my position for about a month now. I started, well, I'm going on 2. I started the day after Labor Day. So I'm still in the learning process. It's nice to meet everyone. And Legita was on another meeting. So you guys got me today.
Thank you so much, Yvette. And if you all would, it did cut in and out a little bit there. If you all have an update and could just like email that to me and I could send that out in the minutes just so we have that information for people who maybe weren't able to hear either now or in the recording, that would be so helpful. Thank you so much. All right, our other 2 updates, they were not able to make it, but they would like me to share some information on their behalf. So Kayla Bledsoe is the manager of the Policy and Resource Initiatives at the Immigrant Welcome Center, and they are going to be having listening sessions for municipal IDs. So Amy, if you'll go a couple slides, I have her flyer, I believe. Yeah, so we will include this as part of the minutes, but If you know anyone or work with anyone, any families experiencing homelessness or immigrant families who would be interested in coming to this listening session, please spread the word. They have the QR code there that people can register, and they have the flyer in a number of languages. I believe it was French, Spanish, and Haitian Creole. I will double check on that, but they have at least 3 different languages to go out, and we will send this out as well. If you have any curiosity or would like to know more information, if you go back a few slides, Amy, Kayla's email is there. I will also send that out when the minutes go out. And she'd love to talk with you or any community partners or organizations who'd be interested in that. And if we can go to the next slide. Jacob Simpson from the IU Center for Rural Engagement has an update about the Food as Medicine program. They wanted to share that they're wrapping up a Food as Medicine programs in 7 rural, Southwest, Central Indiana counties with health, local food, and education partners. And the programs provided meal kits with local food, nutrition, cooking, education tailored to recipes, and cooking supplies. So if you all would like to know more about that process or connect with Jacob or any of the counties who were part of the Food as Medicine program, you can email him there. And if we want to go to the next slide, does anyone else have an update that they would like to share about their county, their organization, or anything that they think would benefit the group?
Julia, this is Michelle. How are
Hey,
you?
Michelle, doing well. Good to see you.
You too. I don't think I've announced on the SNAC quarterly group yet, but we were awarded from our 2021 application with the USDA GusNIP produce prescription grant, and we have kicked that off. Technically, September 15th was the start of that, so we just been on this onboarding with the USDA. But we're excited for that. It's a 3-year grant. We are going to be working with Eskenazi Health and expanding reach throughout their FQHC sites. And then also working with Regenstrief Institute to actually collect some pretty robust health claims and utilization data for the patients who do participate. And so we're going to hope to have some really good information in the next few years. And add to the research and the benefits of these programs. And saying all that, we have just opened a part-time position for a Produce RX project specialist. And I can definitely send you, we have a job summary that I can send you if you want to share with the group. Currently, it is part-time for now. It is with benefits, and it will help with some programming through Eskenazi for Produce RX, specific to the GusNIP grant, but also working in tandem with myself and Elise and other nutrition incentive work.
Great, thanks for sharing, Michelle. Yeah, if you send that information my way, we'd be happy to share that out. And such exciting work. Excited for you all. All right. Anybody else have an update that they would like to share? All right. Well, if you think of one and you would like to share it with the network, just send it our way and we'll get it out with the minutes next week.
All right. Now we will go ahead and move on to our first partner presentation from Jessica Rochester, who is a project manager at the SNAP-Ed Midwest Regional Office. She will discuss more about the White House strategy for hunger, health, and nutrition, and how it will inform SNAP-Ed and other FNS programs that we implement across our state. So Jessica, take it away.
Good afternoon, everybody. Let's see, I'm gonna navigate getting the slides up on the right screen here. And looks like I've got to switch the monitors that are sharing. Let's go back to the very beginning. All right, here we go. Are you all seeing the presenter view or my notes?
Just the
don't see your
presenter
notes.
view.
Yeah. You're good.
Okay, fantastic. Well, and I can't see any of your faces, so I'll just imagine that I'll imagine them. Thank you so much for having me today. I am just a couple of months into my new position here after coming over from being the SNAP Ed Grants Manager in the state of Minnesota. So it's been a pleasure to work with Julia and her team in both roles now, and to hear all about the good work that the SNAC is doing in Indiana. So many kudos to you, and thanks to you all for being on this call. I have some slides. I'm going to set my timer. Some slides here about the 4 pillars of nutrition security, and talk a little bit about cross-program coordination and collaboration. That is what SNAC's one role of a SNAC, right, is to facilitate that collaboration and coordination. Okay, so a couple bullet points what we'll cover today: nutrition security, health equity, and collaboration and coordination. And I asked Julia a little bit about background, about where I should come in, what topics you've all been covering, and I'm excited to share these slides to kind of push the thinking a little bit, make sure we're all working on our nutrition coordination work through an equity lens. So this is exciting. Okay, so first of all, about a year ago, USDA Undersecretary Vilsack launched this initiative of understanding of our needs as nutrition security, not just food security, but nutrition security. And I'm going to try through the presentation not to read off of the slides, but this is the one place I am going to, because it's really important to set this baseline. So nutrition security means all Americans have consistent access to safe, healthy, affordable foods essential to optimal health and well-being. Nutrition security builds on food security by focusing on how the quality of our diets can help reduce diet-related diseases. It also emphasizes equity and tackling long-standing health disparities. There are some great graphics here as well.
Jessica, I don't think we are seeing your slide. I am not
Oh.
seeing graphics on the slide that I'm seeing.
Interesting.
But it all sounds wonderful.
It's still on page 1.
Oh.
1 second. Let me try and fix it.
How odd. Oh, it's advancing.
Is it working now? Is everyone seeing that? Okay. You're good to go.
I have never seen. So you're seeing a slide and notes in the corner then?
No. So when you were sharing, it must be a Teams update. When you shared your presentation, everyone individually was stuck on one slide and we could navigate ourselves. But I have synced it to you now. So when you move, it should move and everyone should follow along.
Okay.
Technology, man. They got to slow it down.
Okay, so here's the definition I was just reading. And in the meeting invitation, the agenda, Julia sent some resources and links to one-page standalone documents you can download. And I think they're at the back of this presentation as well. And the meat of this presentation really is talking about the 4 pillars of USDA's nutrition security initiative, right? And so how it's a big shift to move from just talking about food security, talking about nutrition security. So what is going to drive this work? These are pillars, these are priority areas that now are built into all of our programs, strategic action plans for the coming fiscal year. They're part of our individual performance plans. They're part of how we're tasked in reviewing work plans that come in from our states and their community partners. And let's see. There are, okay, great. So healthy food, that is one of the main reasons that we're here. And can you, interesting. I'm not seeing it as big as it should be. No, that didn't help. All right, cool. There we go. Okay. All right. Healthy food. Connecting all Americans with healthy, safe, affordable food sources. Already, as you can see with these summary points, there is a lot of coordination and collaboration built in. There's an entire pillar for that, but it's almost as if each of the pillars, we have to talk about coordination and collaboration as part of that discussion as well. So it was really, I heard someone speaking earlier about a GusNIP produce prescription program. So something like that might fit into healthy food here. And then meaningful support. How are USDA funded programs going to provide nutrition support throughout all stages of life, really, right? Through WIC to the CACFP through to the, in Minnesota, I'm sorry, we call them MAC and NAPS boxes, but the elderly box distribution programs and initiatives that we're all a part of to update nutrition program standards and nutrition education as a part of that. And then collaborative action. So here's the pillar, but really it underpins all of our work there. How are we as USDA and then working with our partners working on developing, translating, and enacting nutrition science through partnership? And for our extension colleagues on the call, how are we extending that, right? The mission of extension is to take that research out into the community and vice versa. There's a lot of room here to be doing education all throughout the partnerships. And then equitable systems. So how are we prioritizing equity every step of the way? And this is something that I'm really excited to be in communication with you about, because I've listened in on previous quarterly SNAC calls. Julia's told me about some of the work you're doing, and that this is not a new conversation for you. It's something you're tackling head on and pretty explicitly. So really diving deep into that. I have a few slides later about equitable systems and equity lens as well. So we have to recognize that all Americans are not maintaining an active, healthy life that's consistent with federal recommendations. And why? It's not because it's structural issues, right? They have to take an equity lens to an effort. What are some of the challenges that we're having to put these priorities into action? So fair and just opportunity to be as healthy as possible, and knowing that there are obstacles placed in the way of folks who want to have an active and healthy life, such as poverty, discrimination, powerlessness, lack of access to good jobs with fair pay, quality education and housing, safe environments, and healthcare. I'm so excited to see the membership of your SNAC and to have heard presentations from people all around the food access continuum. How do we get to grocery stores? Where do we place farmers markets? How does a livable wage fit into this? It's all part of the same conversation. And so some key takeaways from the food security pillars really are that food insecurity is tightly related to diet-related diseases, and that the rates of these are high and rising and disproportionately impact historically underserved populations. This framework is meant to mobilize. It's a call to action. This is an approach that we can look at where hopefully you see your program represented here somewhere. And you say, this is me. This is the work I'm doing. And look, here's my neighbor. This is the work that my neighbor is doing. And together we can tackle parts of this to advance things together. All right. Uh-oh. Where'd my presentation go?
There we go.
Okay, so coordination and collaboration. It's in the title of the SNAC, right? So the image that we have here for public health champions in the room, social ecological model, right? We're thinking about where are all of the ways that we can affect healthy eating, access to food, physical activity. It's not just the individual's responsibility. We're moving away from that. This is a key component of the nutrition security communications, of the priorities, and really the values of it, is that it's a solution, a problem that we all have to be a part of solving. And our purpose here is to complement other nutrition education and multi-level public health approaches, to not duplicate the work that our peers are doing, to leverage financial resources with funding of other organizations and missions, and to improve program effectiveness and efficiency. These are some lofty statements, right? But I know that that's why we're all here today. Why? Okay, so why should we collaborate? I can tell you why. I've got a few graphics that'll pop up about why technically we're being asked to do that, where in all of our various guidance and statute and initiatives. But I think I come to the table every day wanting to make things just a little bit better and wanting to be efficient at what I do. We're all too busy to be working towards something that we could do better if we were collaborating with a peer, right? And the same conversation when I talk to folks about program evaluation. Sometimes it seems like a dirty word, right? We don't want to do the evaluation. It's scary, but we want to be successful. We're deeply committed, both personally and as a part of your administration or as a part of your organization, to doing better for the people that we serve. So that's the loftier, values-driven statement about why. But some of the technical components of why we're doing this. In 2019, the GAO, this is the kind of the nonpartisan auditing administrative arm in the federal government, released a report about how USDA needs to take actions to assess the effectiveness, coordinate programs, and leverage expertise of all of the USDA funded programs. We are siloed, right? I recognize that. I have to name it because I would be disingenuous if I didn't. The GAO says we have to do better. Who else says we have to do better? The SNAP-Ed guidance says we have to do better. So the guidance that's directing Julia and Amy's work, there are significant sections in here that tell us, A, that we need to have a SNAC for starters, and that B, what that should look like and how we can use SNAP-Ed funding to support it. And now the nutrition security pillars, the initiatives out of USDA Secretary Vilsack. This is telling us that we should do it as well, and it's really spelling out ways that we can all come on board with it, tying together all of the science that we know about diet-related health issues and the structural barriers we have to overcome to address those health issues. So you are doing this, right? You are using values-driven approach. You're tackling things through an equity lens, building in trauma-informed care to collaborate with each other, to address public health goals, to look at things holistically. And we can always be doing things slightly differently or better or more, and learning from our partners, right? So the pillars tell us that we should be partnering with a whole variety of entities. So community partnerships. I see so many folks on the call here today representing nonprofits, faith institutions, schools, community partnerships, state and federal partnerships. Am I picking up the phone to talk to my colleagues in WIC, in the school food program, in FDPI, the federal food distribution program on Indian reservations? Is Julia picking up the phone to talk to her colleagues in different departments? Are Julia's supervisors picking up the phone or walking down the hallway? How can we do better with these state and federal partnerships? And that is a priority that we are having communicated to us throughout USDA, is to talk to Health and Human Services, to talk to education, and also within our own department. To build community investments and to serve as champions. If you have that voice inside of you that's saying, I need to say something about this, this doesn't feel right, how can I carry this weight of making these partnerships? We appreciate you. We see you. Work like a SNAC, work like forging new partnerships, like breaking down silos. It's hard. We need you to be champions of that collaboration and partnership work. Indiana, Midwest, right? Nation's breadbasket. We know that image of silos. It resonates with us. The image on the left, we've got your what it looks like sometimes for us. And then on the right, this is a picture of a public art project in the city of Mankato in Minnesota. And it is still a grain elevator. There's still silos, but they recruited from the community to, it's an active elevator. They recruited from the community to have a local artist, native artist, paint an image of young children learning their powwow dances. And it was a tremendous community gathering. And there's still the departments, right? This is a metaphor. It's a little bit of a challenge here, right? But we can come together to do this. And it's better when we come together to do this. So I'm trying to make my slides have more images and less words. So I was so pleased when a colleague sent me a picture of these slides from Mankato. So, state SNAP Ed coordination and collaboration. We are tasked with coordinating SNAP Ed activities with other health promotion and nutrition improvement strategies, public or private. We're supposed to collaborate with the state and local operators of other food and nutrition service programs and other federally funded nutrition programs. I saw the update from WIC earlier in the call. Good to see you. And of course, our guidance has different components there about how SNAP Ed funds must be used. But when we're in collaboration and communication, we can identify what funding from other grant sources can match with where the gaps are and kind of try and meet community needs. I heard Julia talking about serving meals at the listening sessions, and probably that was a challenge to navigate how to get those meals paid for. So thank you for being a champion in working through that. Multi-state partnerships. This is another way that we can be in coordination with each other. Other state and implementing agencies to leverage resources to learn from what others are doing, especially if initiatives are right on a state line. And of course, the rules are laid out for that in the state SNAP Ed plan as well. But I know USDA has been hiring a lot of program specialists, is my position, to give a little bit more energy to facilitate these communications so that state staff can have opportunities for discussion with their peers and the like across many different programs. For those of you who don't live and breathe SNAP Ed every day, this is one of the guiding documents that guides the SNAP Ed work. These are the goals that we all work to achieve based on our community's preferences, strengths, priorities, etc. But where these two red circles are here really emphasizes the importance of partnerships in general, and then cross-sector, multi-sector partnerships and planning. Are we working across where people live and learn and play? Are you working across business and nonprofit, education? Because that's the kind of robust partnership work that we need to come together to advance our food access goals. The next few slides are just examples of programs that we are working to improve collaboration across at the federal level, and then encouraging at the state level and local level as well. So Julie and I come from the SNAP education corner of the world, but employment and training, and then the benefits administration side of SNAP, there is plenty of room for collaboration there. Farmers market nutrition, senior farmers market nutrition, WIC, really bringing all these folks to the table up and down the organizational chart. Look at all of these opportunities for collaboration with child nutrition programs. I know that there's a large investment happening in community food systems work, and and the like. Team Nutrition and SNAP Ed often partner on developing and distributing nutrition education to satisfy those requirements. And then food distribution, USDA food programs, commodity supplemental food program, TFAP, foods in schools. There are so many opportunities to partner. I know that food shelf and food bank programs are a prime nutrition education and food environment spot. And I see a question and we will get to it. And then these are some more. I know that a lot of the work that Indiana is doing is kind of around this SPAN grant, and I wanted to kind of lift that up and applaud your work. That was something that motivated you to look at what you were doing and how to do it better. These are some of our federal partners. And then this is just a high level summary of opportunities that obviously SNACs are listed there, but these are also partnerships that a SNAC could facilitate itself. Sort of a rectangle and square there's my timer, rectangle and square situation. So I want to applaud the work that you are all doing. Having a SNAC when you have such pressing day-to-day concerns in your community is often really hard. To be strategic, to have those long-term goals and the long-term partnership development. So I applaud the work that you're doing. I encourage you to continue to look for new partnership opportunities within your communities, within your state agencies, and across your federal partners, and know that we are working on it as well. So that concludes my slides. I think we still have a little bit of time for questions, minus the technology there. I can start with Elisa's question. She says, with the emphasis on collaboration, I've heard that SNAP-Ed cannot help enroll people in SNAP. Is this true? If so, is that because of how policy is worded, or is there a way to help with collaboration on that? That there are a couple of things in Elisa's question. So it's true that SNAP education is not allowed in our guidance in our statute to actually enroll folks in SNAP, but SNAP Ed is required to make sure that participants know that SNAP is available in their communities, and that oftentimes SNAP Ed educators or staff are trusted trusted members of the community from which they are serving, right? And so they're often the first place that people turn for help. If you have a referral, a poster up, then a community member might want to ask help additionally from that. And they aren't allowed to do that, but they are allowed to make referrals to the SNAP outreach program in a community, or if there is a helpline or statewide registration line. There are some ways to take allowable activities a little bit further than just posting a recruitment referral flyer. There's also some language in the SNAP outreach guidelines that make it that are important to consider around simply educating that SNAP exists and not promoting that SNAP exists. There's a fine line there that staff have to make sure not to cross. But there is a way to go just a little bit deeper to make sure that you are helping the next step be really clear for a participant if they should ask about how to sign up for SNAP, to keep that flowing. But it's true that SNAP-Ed cannot help actually enroll community members in SNAP.
Yeah, and I'm going to make sure I'm linking the right thing. The Family and Social Services Administration in Indiana is the SNAP outreach administrator. So I'm going to throw this in the chat. It just lists out the SNAP outreach partners. And then we have SNAP education, which is implemented through the Indiana Department of Health and then flows through Purdue University Extension Nutrition Education Program, and then the SNAP Employment and Training Program. So we have thought about this, Elise, and we've talked with some of the SNAP outreach providers, Gleaners, Food Finders, Feeding Indiana's Hungry, and that is definitely a collaboration that we're wanting to expand more on. We have So we're going to be exploring more of that conversation. So I'd be happy to talk with you offline about that if you have any ideas. All right. Are there any other questions for Jessica? All right. Thank you so much, Jessica, for your time and putting together the presentation. It's really helpful to explain how we can best collaborate and how that goes back towards the goals really of the USDA right now and those main pillars. So thank you so much.
Yeah.
And at this time, we are going to move over to our next presentation. Our very own Director of the Division of Nutrition and Physical Activity, Lindsay Boza, is going to be presenting on the White House strategies. Did I freeze? Okay. And how that intersects with what we do at the Division of Nutrition and Physical Activity and how we all can work together to address maybe some gaps that have come to the surface as a result of reviewing some of those strategies. So, Lindsay, if you want to go ahead and start, that'd be great.
Yes, thank you. I'm going to pull up the PowerPoint here, so just give me one sec. Okay, so I'm not sure what you can see right now. Are you seeing just the slide, or is it in are you seeing the slides on the side?
We are seeing the slides on the side, so I don't know if you can go down to the bottom and do the view
Okay,
tab.
put this one here. How about now? Are you able to see just the opening slide?
No, we can
Still
see the slides on the side. Yeah,
Okay.
I could present it too if that's helpful.
All right, let me see what I can do here. Stop sharing and see. Sometimes having 3 screens is maybe too much. Try one more time. This worked for me the other day, so I'm not sure why it's not right now. Luckily, we have a few minutes built in. Okay, how about now? Are you still seeing the slides on the side?
No, we are
Okay, you can
seeing,
just see the opening slide?
yes,
Perfect. Okay, and then does it go to the next one?
sure does.
Perfect. All right, I think it's working. Okay, so yeah, thanks for having me come and speak on the meeting today. Really kind of happy to share the information that we've been learning that has come out from the White House conference. So I imagine that many of you did take the time to sit in on that White House conference back September 28th on unveiling the National Strategy on Hunger, Nutrition, and Health. And they mentioned during that day that this has been the first time that something like this has happened in maybe over 50 years, I want to say. So it's very exciting for the work that we all do that this has become a priority for the current administration in the White House. So what we're going to do right now, I'm going to spend a little bit of time going through the pillars that have come out as the priorities with the national strategy. Unfortunately, it is very wordy, these slides. I don't have a lot of pictures, so as opposed to what Jessica mentioned, she tries to put more pictures in and less words. This is going to be probably the antithesis of that, so I apologize in advance. But if you have read the national strategy, it is 44 pages, so it is quite a bit to try to condense into maybe 15 slides. But what we tried to do is kind of pull out some of the main points that this group would be most interested in hearing about. So I do encourage you, I have the link there. And I know Julia will include the link as well, Julia and Amy, in the minutes that get sent out. So if you do want to spend some time reading through that document, mine's all highlighted and marked up and dog-eared. So I would encourage you to do that. So a major goal, or their kind of overall overarching goal for this national strategy, is to end hunger and increase healthy eating and physical activity by 2030 so that fewer Americans experience diet-related diseases like diabetes, obesity, and hypertension. One main takeaway here that came out through the national strategy is that it's going to take all sectors of influence to meet the goals of the White House. Some we may be able to help along, but some we probably won't have much control over. From the documents on the website that you'll see, it sounds like there are many organizations that have signed on in support, even the private sector, agricultural workers, philanthropists, such companies such as Cisco and Aramark, and many others have signed on to support this work moving forward. It's going to take an all hands on deck type of approach. So the 5 pillars of the national strategy are listed here. They include improving food access and affordability, integrating nutrition and health, supporting physical activity for all, empowering all consumers to make and have access to healthy choices, and enhance nutrition and food research. So what we're going to do over the next 15-20 minutes or so is kind of go through these pillars individually, and talk about some of the highlights, some of the main components that are being recommended, and then which sectors are being kind of targeted to work on some of those strategies, and how we are already doing some of these and how we could be doing more of these. So I will be going through that now. So first pillar, improving food access and affordability. Ending hunger by making it easier for everyone, including individuals in urban, suburban, rural, and tribal communities and territories, to access and afford food. So first component of that is to help more individuals experiencing food insecurity benefit from federal assistance programs. One is advancing a pathway to free, healthy school meals for all, which includes expanding efforts to increase access to local and regional food systems. Expanding SNAP, and looking at kind of other demographics that maybe haven't been included as much as they should be, such as incarcerated individuals, college student eligibility, and those that are aging out of foster care. Making it easier for individuals to access federal food, human services, and health assistance programs, such as SNAP, WIC, and Medicaid. So advancing the WIC modernization strategy, increasing outreach and awareness for SNAP, and better connection with state childcare agencies and agencies that provide nutrition and food assistance. Also connecting workforce and SNAP agencies. And then also modernizing federal programs so that individuals can more easily utilize benefits. Things like updating the online shopping experience for SNAP and WIC. The next component of Pillar 1 is investing in community and economic development in order to increase access to food. So we have leveraging housing and other community programs, improving transportation options to and from grocery stores, farmers markets, and commercial districts. And that includes things like promoting transit, bike and pedestrian improvements, reducing barriers to food recovery. So looking at a whole of government strategy to reduce food waste, updating the food code to address food donation recommendations. And then you have improving access to emergency food, including during natural disasters. So improving access and equity for TFAP, addressing gaps for families to receive food of their culture. So for Pillar 1, there is a part of the national strategy that is a call to action at the end of each pillar. So the call to action is a whole of society approach. I mentioned that at the beginning, that it's going to take multiple sectors to work on these strategies. The ones highlighted in yellow here are ones that we believe we are actively working towards. State and school districts should increase investment in school food programs, such as providing investments to support kitchen infrastructure and train nutrition professionals. State, local, and territory governments should provide incentives and technical assistance to attract healthier food retail outlets to underserved areas. And the private sector should invest more in year-round mobile produce markets and retail outlets within underserved communities. So we know that either our work at IDOH DMPA, other IDOH divisions, or those of you that are already out there doing some of this work, we know that the highlighted ones are ones where we already have at least some movement or some initiatives going on in the state. Okay, pillar 2, integrating nutrition and health. So prioritizing the role of food and nutrition security in overall health, including disease prevention and management, and ensure that our healthcare system addresses the nutrition needs of all people. First, part of that would be providing greater access to nutrition services to better prevent, manage, and treat diet-related diseases. So one is expanding Medicare and Medicaid beneficiaries' access to food as medicine interventions, such as expanding medically tailored meals and produce prescription programs, expanding Medicaid and Medicare beneficiaries' access to nutrition and obesity counseling. And this is especially geared towards states that have not expanded coverage, which we have in Indiana, and those states that have large rural populations. And better support prevention and management of diabetes. So making Medicare diabetes prevention program a cost-effective, permanent Medicare preventative service benefit. Other parts of Pillar 2 include screening for food insecurity and connecting people to the services that they need. So universally screening for food insecurity in federal healthcare systems and within that, incorporating social determinants of health into healthcare to better recognize root causes. Incentivizing hospitals to provide services, focus on food insecurity and other social determinants, allowing spending on social determinants of health to be part of the community benefit that hospitals have money to spend on. And then C, strengthening the diversity and diversify the nutrition workforce. So bolstering the healthcare workforce, including nutrition professionals, and ensuring that other medical professionals receive nutrition education. Increasing the diversity of registered dietitians and nutritionists and expanding their reach to areas with limited care. Training registered dietitians, nutritionists on pediatric obesity prevention, household food security, and nutrition during pregnancy. So the Pillar 2 call to action, again, some of the highlighted items here. I realize I don't know if I have the updated presentation. Okay, some of these I had highlighted in green, so but I'll do my best. So how we are handling some of the highlighted items: states collaborating with nonprofit and community-based organizations to establish a state-funded produce prescription program. We know that there are some of you on the call, and there are other organizations that and healthcare that do produce prescription programs, and we're currently at the state funding a pilot produce prescription program. So hoping that those could turn into a state funded produce prescription program. Integrating nutrition experts into health departments and modernizing scope of practice laws to allow healthcare professionals to play a larger role in disease prevention. And then addressing social determinants of health, such as screening patients for food insecurity. We know that we have some partners out there that are already doing that. And connecting patients to nutrition assistance services. Okay, Pillar 3. Thank you all for bearing with me here. Empowering all consumers to make and have access to healthy choices. So fostering environments that enable all people to easily make informed, healthy choices. Increasing access to healthy food. Encouraging healthy workplace and school policies. And investing in public education campaigns that are culturally appropriate and resonate with specific communities. First option here is empowering consumers with updated and more accessible food labeling. Making sure that foods labeled as healthy align with current nutrition science, as well as the dietary guidelines. So updating the standards for using healthy on packaging and using a specific symbol. And then facilitating making nutrition information easily available when grocery shopping online. I know that when I do my grocery shopping online, I try to look for those nutrition labels and sometimes, and they're not always easy to find. Also, we have Pillar 3, the second category being creating healthier food environments and a healthier food supply to make the healthier choice the easier choice. So expanding incentives for fruit and vegetables and SNAP programs such as GusNIP, the Gus Schumacher Nutrition Incentive Program, which Michelle Shippey actually mentioned earlier on this call. Facilitating lowering the sodium content of food. We know that Marion County Public Health Department has had some sodium reduction grants over the years, and so continuing to work on those and lowering the sodium content, and also lowering the sugar consumption. Expanding access to healthier environments in federal facilities, implementing food service guidelines in federal and state facilities, the Department of Defense's child development programs, and also expanding the Go for Green program, which is a Department of Defense program. Leveraging federal nutrition assistance programs to promote healthy habits, updating nutrition standards in schools, and updating the package of foods offered by WIC, USDA Healthy Meals Incentive Initiative, and CACFP. And then we have breastfeeding as well. So expanding breastfeeding support and counseling for mothers, testing virtual breastfeeding support for WIC, requirements for coverage of breastfeeding support and counseling without cost sharing. So the rest of Pillar 3 here is supporting robust and tailored nutrition education. So supporting regular updates to the dietary guidelines and carrying out a national education campaign. Develop tailored nutrition education and leveraging SNAP-Ed to promote healthy foods. So with developing a tailored nutrition education, the prison system will support inmates and families by adding curriculum to address dietary needs for vulnerable populations in its culinary arts vocational program. And then leveraging SNAP-Ed, USDA will promote MyPlate's Shop Simple digital tool and expand SNAP-Ed connection. I'm actually going to try to take a minute here and find the correct PowerPoint I'm supposed to be using. So this was my original one before I updated it. So I apologize. I'm just going to take a minute and try to find the right one. This will give you all a chance to digest some of this information. All right, I don't know what happened to it. So I'm just going to keep going along with this one. Go back. Hopefully we can share it easily again.